Hi, and welcome to another Neuroscience for Kids video with UCLA InterAxon's Media Committee. Today we're talking about something very important, drugs and addiction. Before we get started, we need to know, what are drugs? Well, put simply, drugs are substances that cause changes to your body's function. There are many different types of drugs. Some drugs like tobacco can hurt you, but others, like medicines, can help you. Drugs can also be legal or illegal, but that's always changing with new laws. Learning about drugs can be confusing because it's such a vast topic. Even though there's tons of information, it's not boring. I have no doubt that you'll be able to learn a lot today. So let's get started. I want to start us off with drug classifications. We said it earlier and we'll say it again. There are many different types of drugs. Two drug types we're talking about today are stimulants and depressants. First off, stimulants are drugs that will increase your nervous system activity and promote your body to react. When you think about stimulants, think S for speed. Short-term responses increase your bodily functions. For example, a stimulant like coffee can raise your alertness and speed up your heart rate. Paired with these short-term effects are long-term effects from frequent use. These effects aren't very good, as they include addiction, anxiety, and stress. We'll talk more about addiction later on. In contrast to stimulants, there are drugs called depressants. Depressants slow down the central nervous system, which includes the brain and spinal cord, instead of speeding it up. Short-term effects of depressants, like alcohol, include impaired judgment and decreased body functions, like lowered heart rate. In the grand scheme of things, long-term usage of depressants can lead to addiction, sleep problems, and even death.
In talking about the different types of drugs, it's important to keep in mind the effects of addiction. What exactly is addiction? Well, depending on how you think about it, there are a couple different types and theories behind it. Let's start with the physical side of addiction. So, how do you think addiction can affect someone physically? If you answered with withdrawals, you'd be correct. Withdrawals are the most common symptom associated with physical addiction, and they occur when someone who usually takes a drug suddenly stops. Their brain is so used to this drug that when it doesn't have it, their entire body starts to complain, and it can be really painful for them. Now, on the other hand, there's behavioral addiction. Behavioral addiction occurs when your brain is not physically addicted to something, but still craves it because of frequent use. Some common symptoms linked with behavioral addiction include anxiety, social isolation, and depression. Withdrawals, while a physical symptom, can increase the chances of developing these other symptoms, so it's important to always think about both. Moving on to the theories of addiction, we have disease theory and situational theory. In disease theory, addiction is treated as just that, a biological disease. Situational theory, on the other hand, takes into account the addict's background and situation in diagnosing them. Both of these theories are great, but the truth is we can't just focus on one. It makes much more sense to take both into account. While addiction involves definite biological and genetic underpinnings, it has also been shown to be heavily related to poverty, childhood trauma, and other sources of stress. In both theories, too, it's important to remember that addiction is beatable.
Drug myths. You might have heard of some drug myths before, maybe about vapes or alcohol, but now is the time to clear things up. Let's start things off with marijuana. People may have said that marijuana isn't very addictive, for example, but in fact, it is. It binds to structures in the brain called endocannabinoid receptors over and over again, causing dependence. It might have been made out to seem healthier than traditional cigarettes, but this too is false. The smoke from marijuana actually contains 3 to 5 more cancer-inducing agents than tobacco. Similarly, we could talk about vaping versus the traditional method of smoking tobacco. Vaping may also seem as a healthier option, but in reality, the e-juice might actually be more harmful to your lungs. Of course, vapes contain nicotine, making them just as addictive as traditional tobacco products. So always remember this and be careful. Now let's talk about Adderall. Many people might have heard the myth that Adderall makes you smarter. The truth is, Adderall may make you feel more focused, but that could be a placebo effect, meaning that you only feel smarter because people told you that you would if you took the pill. People may also say Adderall must be safe because doctors give it to their patients. People who take Adderall without a prescription may get headaches, have trouble sleeping, and are at risk of getting seizures. They're also at higher risk of a heart attack, stroke, and liver disease. It's it's important to remember that no drug is free from side effects. There's also a lot of myths about alcohol. Some people say it makes them feel more energetic. The active ingredient in alcohol, called ethanol, does act as a stimulant at low levels. However, at high levels, it acts as a depressant, so it actually slows down your brain functions by lowering the levels of neurotransmission. You might have heard that alcohol kills your brain cells. Alcohol doesn't actually kill your neurons, which are your brain cells, but it can damage the ends of the cells, called dendrites, so it becomes harder for your brain cells to communicate. Another popular belief is that you can just drink coffee to sober up. Coffee has caffeine, which is a stimulant and can make you feel more energetic, but it does not get rid of the alcohol in your system.
Opioids are a widely prescribed class of drugs that can cause addiction. So how do opioids work? Opioids are strong pain relievers that can be safe to take for a short period of time and under the supervision of a physician. They cause the patient to feel euphoric so that they don't feel pain. This happens because opioid causes dopamine, also known as the feel-good hormone, to be released in the brain. The dopamine targets the brain's reward system, which makes people want more. Some popular types of opioids include oxycodone, hydrocodone or Vicodin, codeine, and morphine. In the US, more than 2 million people every year misuse opioids. Experts refer to it as an opioid epidemic. The more opioids that are taken, the less sensitive the brain is to its effect. So people feel like they need to take more of the drug to get that same euphoric feeling. This tolerance often leads to addiction. Opioid addiction is dangerous because overdosing can be fatal.
What are the types of addiction and what are their major symptoms? The types of addiction are physical and behavioral addiction. Physical addiction is most closely linked with withdrawals, whereas behavioral addiction mainly has problems involving mental health like anxiety or depression. Let's see what you know about drug myths. What does alcohol do to your brain cells? Does it kill them? Remember, alcohol doesn't kill your neurons, but it could damage your dendrites and make it harder for your brain to communicate.
Well, that concludes our video for today. We really hope you enjoyed learning about drugs and learned something new about how different substances affect human bodies. Thank you so much for coming by. See you next time.
Thank you so much for coming by, and see you next time.